As we see many mothers and fathers complaining about their kids and their children and their frequent movements. Unfortunately, this child is usually described as a naughty child or a child who cannot be already controlled. Some parents are bothered by their children's overacting, they're punishing them, they are going there and there, they cannot control them. So let's welcome more about Maraheb Al-Qallaf, a speech language physiologist, right? Okay, and Bas MS, Ruba, Khair, and also the physiotherapist, BSCPT, MSCPT. So hello and welcome to our show, Sunshine.
Good morning.
By the way, you already know how to come to the studio, right?
Oh, yeah. We had so many interviews in the past, couple of years.
Okay, and if you want to come along, you will get lost here, right?
Yeah, I came before, but not to the studio, maybe.
To another studio.
Another studio.
But we are very excited, and thank you for joining us this morning. But first of all, what is ADHD stand for? Ruba.
So ADHD is an abbreviation for a neurodevelopmental disorder, which is attention deficit hyperactive disorder. And from the full name, we can know it's about attention deficit, so the child has no attention. Hyperactive, that means he moves a lot. It has three types, which is the first one, which is the attention deficit, is more obvious. So the child has no attention, but he's not moving that much, and this is more common in girls. The other one is the hyperactivity is more obvious than the attention, and this is more common in boys. And we have the most common type, which is the hyperactive. He's hyperactive, and also they have attention deficit. And this is, we can say it's the more severe type. The child here is moving a lot, and at the same time he has no attention. And this also affects more, or it's more, 2 times more in boys than girls. And when we have this combination,
so we are the one who make troubles all the time?
It's not troubles. As you said, we describe them as naughty, but honestly they are not. It's this how they perceive the world around them, and that's why it's affecting their ability to participate in daily activities. And if these children get the right support, they will perform better and they will be able to participate more and go to schools and be a productive citizenship in the future.
Nice. The good thing that I already noticed that you both love kids, right?
Yes, we do.
So Maraheb, because of she's talking already about the stand for ADHD. So what about the signs, the symptoms? How can I know if they are ADHD?
So the most obvious sign is having trouble focusing to perform a task, a single task. Like if mom tells the child, go brush your teeth, it's time to go to bed, they will have trouble following this direction because they're always distracted. They have so many thoughts going on their minds at the same time. So this is the main the sign. The other one is difficulty having difficulty in an academic setting, especially in schools. They don't hear what the teachers are saying because they're busy daydreaming and distracted. The other thing is having trouble to plan and organize their information, especially if the child have a language delay. They cannot initiate just a conversation, a proper conversation to comment. They have difficulty, forming friendships too, because they lack the social skills. So mainly those are the signs of ADHD.
And you are working together how many years?
We've been working for maybe 6 years now.
So you're dealing with too many variety of families, variety of kids, right?
Exactly, yeah.
So speaking about the variety, I know you want to say something. So about how does ADHD affects children's development? I know you are already preparing yourself to ask.
I just want to say we work together a lot.
Okay.
So as we said, a child who has a developmental delay usually has more than one need, and that's why we work together. We are a team. We have also other members from other specialty joining us. So how this ADHD affecting the child, we don't know the cause really, but some people say it's environmental, some research say it's maybe inherited, or it's at the end it affects how the brain is working, and mainly specific area of the brain that affect decision making and control. So it affects the child speech area, it affects the child motor skills, it affects the child organizing skill. And from here we know that the child who have maybe ADHD might need a speech therapist, might need a sensory integration therapist, might need an occupational therapist and a physiotherapist and behavioral therapy. And when we provide all of these services, we can notice that the child is able to perform better.
Nice. Because you're already sharing to the viewers watching us through the KTV2, you have a variety of like therapists.
Yeah.
So one hand cannot clap, right?
Yeah.
So what about the other people who's working with you, their names, Maraheb?
So we have a behavior therapist, we have occupational therapist and physiotherapist, speech therapist. We also have a psychologist, you know, especially if new parents to new kids want to know what, what's the problem with their kids. So they go to a psychologist, to get a diagnosis of, ADHD or maybe autism or anything else.
And we also see in the two books, you see the videos already, how you are training them. This is you, Ruba.
Yeah, that's me in the clinic.
So it's a question for you, because you're already seeing about the two books. How does it feel like you're working daily and with the kids, you are following them for your sake?
Honestly, working with children with special needs, at the beginning you feel it's a bit hard, sad, but then when you treat a child who's not able to walk and you see him taking his first steps, it's something different.
It's a rewarding feeling.
Yeah, it's very,
to
you
see
feel
the kids happy and their parents so happy.
Yeah, they are like our kids. It's the same feeling when your child takes the first steps. Seeing the happiness in the parent eyes is really very important for us. And as Maraheb said, I want to highlight something about diagnosis of ADHD. Not any child who's naughty has an ADHD, or who's moving a lot, he has an ADHD. That's why it's important when you feel that the movement of your child is affecting his participation. So when you call your child many times and he's not responding, but he's not watching his favorite TV show, then you have to start concern when the teacher is concerning that the child is not, then maybe you have to seek the right help, someone who will do a really comprehensive assessment, because there is an overlapping. Differential diagnosis is really important.
Yeah, you already goes me to a question for your colleagues, Maraheb, about how can she already gave me the hints.
Yes.
So how can I suspect that this child have to seek help?
Okay, so as I mentioned, the first sign is to have, having a trouble focusing on one single task. The other thing, excessive movement. It's very normal for kids to have a lot of energy, but this kind of energy is different. Excessive movement, can't sit still on a chair. When you ask your child to sit still, they can't do it. They just can't do it. Even in school, they keep, leaving their seat so many times, and you notice like the child is, excessively talking, interrupting conversations. So with all of these signs, I think the first step is to seek psychologists, educational psychologists help to, as Ruba said, to get a differential diagnosis, because the signs of ADHD might be something else, or it might be two diagnoses at the same time. So they need to differentiate. Is it a global developmental delay? Is it ADHD? Is it autism spectrum disorder, or something else that,
As your profession, as pathologist, did I pronounce it right or wrong?
Pathologist, yes.
How take your time to memorize how to say it, Maraheb?
You mean, we say SLP. It's easier for us.
Yeah?
Yes.
Okay, but as a profession, as a Sophie, what about the common things, the common problems, the same difficulties that the children facing about their speech?
Yeah, you mean about speech delays?
Yes.
Okay, so the first thing we do is we see the parents for an initial assessment. We assess the child's comprehension skills, which is the ability to understand what the speaker is saying. We check for expressive language, which is how the child puts the words together to perform, to form a sentence, a proper sentence. And the other thing, we check for play skills and social skills. If I suspect that there is a concern, I directly speak to my colleagues, because we work as a team. I refer the child to see and seek specialist help that might help them a lot. And
now we'll go to her now, because you already signed to her, pointing on her. So what about the sensory integration disorder in the children who have ADHD, and how can we recovering it?
So as we said, children with ADHD and all the children who has other delay might have something called sensory integration disorder, which it's a difficulty in receiving this sensory information around us and use it, even for proper movement or for like I'm now focusing on you while there is a lot of cameras moving around me. It's my ability, my brain ability to stop the things from me and just focus on you. And this is what children with ADHD might have difficulty. That's why when a TV is on, he just look, and then someone is moving him in the classroom. Any child make a single movement, you find him he's unable to filter the sensation.
And multitask at the same time, because this is kind of like multitasking.
Yeah, and like now I'm focusing on Maraheb, maybe I can have something behind me making a sound, but I'm able to filter it, stop it, and focus on her. Some children don't have this ability, and then they get really distracted.
Nice. Well, actually, I had so much time with you both. Now I understand why you want to go to work again after the studio, because of the kids. Because we already reached the end of our interview segment, but for sure, be with us again in our show, okay?
Sure.
Thank you very much for being with us today, dear viewers. Let's go to this break, then we'll continue our segments.